Good day, my name is Yañez, and I am going to be doing the return demonstration of the caring for the caring for patient in an isolation unit. So caring for patient in isolation unit is a procedure intended to prevent the transmission of the infectious agents to healthcare personnel, to the patient, and of course to the visitors in an healthcare setting. There's also a clinical practice that is used to prevent the transmission of the infectious diseases through acquired in blood or in the body fluids, and even in the non-intact skin integrity or skin. The purposes are to prevent the transmission of the microorganisms. Next is to maintain the safety of the patient and to promote the patient's comfortability by not enabling them to feel that they're being singled out or isolated. And lastly is to isolate the microorganisms. The principles are always do the hand hygiene before donning and doffing the PPE. Next is to discard the waste to the proper waste receptacle. And next is to always touch the cleanest to the most contaminated part of the PPE. And the equipment are the gown, the mask, the gloves, the goggles or the eyewear, the pen, and the paper lining. First is to check the physician's order for the type of precaution and review precaution and infection control manual. This is to secure that you're engaging with the right patient and you have the appropriate nursing precaution. Second is plan nursing care activities before entering the room. This is to avoid going back and forth in getting the necessary equipment, and it provides you one-way procedure and avoid cross-contamination in and out in isolation room. Prepare a lining, BP apparatus, stethoscope, cotton balls with alcohol, a piece of paper for data to be gathered. Number 4, provide instructions to patient, family members, and visitors. Providing instructions to family members and visitors does not only avoid them from becoming infected, but also it's a health teaching and how or what are necessary precautions upon entering the room and going out the room. Next is to perform hand hygiene. This is to avoid cross contamination and prepare for safety gears or PPE. Put on gown, gloves, mask, protective eyewear. Put on gown by inserting hand and arms into the sleeves, touching only the inside part of the gown. Putting gown by using sterile technique and inserting hands inside avoid contamination of the gown. Tie gown securely at neck and waist. Obtain waterproof gown if soiling is likely. Securing the gown's locks ensures that you are fully covered and does not allow room for any contact with any article or equipment in the isolation room. Use clean disposable gloves. If worn with gown, draw glove cuffs over gown sleeves. This is to properly dispose contaminated glove and avoid cross contamination and as well as avoid any skin exposure. Enter clients with the necessary equipment. Place paper over the table and put on equipment. Take vital signs. Follow the procedure in taking TPR. Record the data with the use of wrap pen and a piece of paper provided for. For BP taking, put on the client's left arm and place the stethoscope on the top of client's gown and then put BP cuff on the top of the patient's gown. And leave the client comfortably. This is to facilitate an ease of mind and help her reduce stress and recuperate. When patient care is completed, untie waist string of the gown first, then remove gloves, drop in appropriate container. Remove mask. For surgical mask, untie mask and drop by strings into waste container. Hang the gown on a stand with the shoulder seams together and only the contaminated portion is exposed outside the environment. Perform hand hygiene. This is to disinfect your hands since it is the part of your body that made the most contact with the patient during the procedure and was used in removing gowns and PPE to avoid cross contamination and removing the pen cover without touching the contaminated part to avoid cross contamination. And lastly, record data gathered and procedures done. This is to establish pertinent data used for continuous evaluation of patient condition, and the procedures are considered undone if not recorded.